There are 7 signs of diabetic feet you shouldn't ignore. Most people have symptoms, but still choose to wait until something looks obviously bad, red, swollen, maybe leaking. But diabetic feet almost never start that way. And there are ways to tell if what you are seeing is normal or if it's something urgent you need to take action on immediately. Which is why in this video, I'm going to show you the 7 signs of diabetic feet that you can't ignore before it's too late. And stick around, because at the end, I'll share the #1 mistake even experienced providers make when checking diabetic feet. Now, a lot of people don't understand some of the warning signs and symptoms that are crucial to understanding if what you have is serious or not. In fact, some of the most dangerous warning signs are things we ignore on purpose because they don't look scary, because they don't hurt, because they've always looked like that. But I want to take you inside the exam room for a minute. There's a patient I still think about years later. He was 54, came in for his blood pressure medications. He didn't think he had a foot problem, just a weird spot on his pinky toe. He said, "Doc, I almost didn't mention it because it doesn't hurt at all." But when we took off his sock, the toe was gray and cool to the touch, no pulse. He had no idea it was dying. And by the time he did notice, it was too late to save the toe. If you're new to wound care, or if you're managing diabetes for yourself or someone you love, this doesn't have to be your story. The signs are there. You just have to know what to look for. Let's start with the quietest one. Sign #1 is numbness. It seems harmless at first, and patients sometimes say, "I don't really feel my feet much anymore." People say it like it's just part of aging. But loss of sensation means your internal alarm system isn't working. No pain equals no signal to check the foot. That means you could step on a tack, develop a blister from your shoe, or burn your skin and not even notice. I once saw a man who cooked barefoot on a hot patio grill, not realizing the metal was scalding his heel until his wife pointed out the wound. That's what we're dealing with here. Numb feet are silent risk zones. And if your patient or your loved one can't feel the bottom of their foot when you gently press with a finger or the edge of a pen cap, that's a red flag. Sign #2 are calluses that keep coming back. Calluses might seem like a sign of tough skin, but in diabetic feet, they often mean pressure. Too much rubbing or weight in one spot. And pressure is the first step toward a wound. Think of it like tectonic plates. Friction builds up under the surface until something gives. The thicker the callus, the more likely there's something brewing underneath, especially if it's in the same spot every time. I had a patient who wore the same pair of work boots for 3 years. He didn't notice the callus growing thicker until we finally shaved it down and found a blood blister underneath. It was pre-ulceration. He was walking on a wound and had no idea. Don't ignore calluses. They're not just skin deep. Sign #3 is skin discoloration. Purple, red, yellow, brown, even shiny or pale. These color changes are often your first clues that the skin is struggling. The challenge is most people don't know what their normal skin looks like, so they can't tell when it changes. When I teach nurses, I always say the skin tells you everything. You just have to ask it the right questions. If you see patchy redness that doesn't go away, or areas that look bruised or discolored, don't brush it off, especially if it's around the toes or heels. Those are pressure zones. And in diabetics, color changes can be the body's early SOS signal. Sign #4 are foot shape changes. This one sneaks up slowly. The arch collapses, the toes curl, the foot starts to widen or bulge in weird places. It's often written off as just arthritis or just aging. These changes can be early signs of Charcot foot, a serious complication of diabetic neuropathy. The bones start to shift, the ligaments get loose, and if you don't catch it early, the entire foot can break down. Sometimes it starts with swelling, warmth, and the sense that the foot looks different. One patient I saw came in for ankle pain, but her midfoot was hot and red. She thought she had a sprain, but it was early stage Charcot. We caught it just in time. She spent 12 weeks in a total contact cast and we saved her foot. The earlier you catch this, the better the outcome will be. Learning more about this together is actually one of the reasons why I built the Wound Care Circle, because so much of wound care is about connection, learning from each other, sharing what works, and not feeling like you're managing these complex wounds all by yourself. Inside the community, we talk through real cases just like this one. You get to hear how other providers are handling the same challenges, and you realize you're not alone in this. You can access the link below. Sign number 5 is dry, cracked skin, especially on the heel. Dry skin might sound like the least serious problem on this list, but in diabetics, dry skin equals skin that can split open, and a cracked heel is like an open door for bacteria. The worst part is that these cracks don't always bleed. They just sit there, waiting for the next infection. Fungal infections love these little crevices. And once the skin barrier is broken, all bets are off. To fix this, moisturize daily. Check the heel edges. And if you're caring for someone else, flip the foot and look. Even a 1 centimeter fissure can open the floodgates. Sign number 6 are changes in toenails, thickened, yellow, curved inward, or oddly lifted up. Fungal infections are common in diabetic feet, so are ingrown nails, and both can break the skin. I've seen cases where a fungal nail pushed into the skin beside it, causing a chronic wound that just wouldn't close. Nails are often ignored until they're painful, but pain isn't a reliable sign in diabetes. Look closely at the nails. Are they flaking, lifting? Does the skin around them look angry or wet? That nail might be the canary in the coal mine. Sign number 7 is drainage in the sock. This one is an unfortunate situation because it usually means the problem has already broken through. If someone takes off their sock and there's a spot, either yellow or brown or even pink, don't assume it's sweat. It could be drainage from a wound, or worse, from a deep infection. I've had patients come in saying, "I think I stepped in something," when the real problem was hidden inside their shoe. When in doubt, take off the sock and look. The sock never lies. Let me circle back to Mr. R, the patient with the great toe. That one appointment turned into 3 surgeries. He missed months of work, lost his toe, but what he really lost was his sense of safety. He used to say, "I thought I was doing okay. I didn't know what I didn't know." Now, what's the common mistake people make when checking diabetic feet? They only look at the bottom. They forget to check between the toes, behind the heel, along the sides, or they rush through the exam in 5 seconds and miss the one thing that could have made all the difference. So if you take one thing from this video, don't wait until something hurts. Diabetic feet don't follow the same rules as regular feet. They whisper, not shout. And if you know how to listen, you can catch the signs early and prevent the kind of damage that changes lives. But now that you know how to identify if a diabetic foot is in trouble, you still need to learn how to actually help it heal faster. And there's something I've been doing recently that helped me do just that: speed up wound healing in my diabetic patients in a major way, which is why I made this next video where I walk you through the exact treatment approach that changed everything for me and my patients. Stay informed and heal well.